How's your Indonesian going, all right? Selamat pagi, what does that mean? Oh, good morning. It's good afternoon. I've forgotten what good afternoon. Okay. Could we take a seat, please? Could everyone take a seat, please? We've still got a few stragglers that are coming down from lunch, but with Chris Bowen here, I think we should get underway. They've got, as we said earlier, a very, very busy day in Parliament today. So we're delighted, honoured to have the Shadow Treasurer, Chris Bowen, with us today. Chris entered Parliament in 2004. He's held a wide range of portfolios: Treasurer, Minister for Human Services, Minister for Immigration, Minister for Financial Services, Minister for Competition Policy, Small Business, Minister for Tertiary Education. He served as interim leader of the Labor Party and acting leader of the opposition following the 2013 federal election. And of course, he's been the Shadow Treasurer since then. He has a number of qualifications: Master's degree in International Relations, Bachelor of Economics degree, and he's just completing his diploma in modern languages in Bahasa Indonesia, Indonesian, which he's going to speak to us in Bahasan today. Chris Bowen, as you know, spoke to us last year. He's been a great supporter of Australia-China Business Council. Would you please welcome Chris Bowen?
Terima kasih, Premier. Well, thanks for the invitation to be with you. This gathering has become a very important one, I think, in our calendar in Parliament House, perhaps getting a little more attention this year than usually, and that's not a bad thing. Maybe the reason you're getting more attention is a bad thing, but this gathering getting more attention is a good thing. I thought in the 10 or 15 minutes that I'd talk to you today, I'd cover a couple of things broadly: our approach to Asian engagement more generally, and the state of bilateral relations with China, which is obviously a particularly important focus for you, before spending an equal amount of time on questions, suggestions and accusations from the floor. As you said, I spoke to you last year about our interest in Asian engagement, my personal interest, the prioritisation we'd put on that as the alternative government, and that remains as important, arguably more important now than it was then. Since then, of course, we've formalised some of the things that I was talking to you about last year in our Future Asia policy, our Future Asia framework. We've announced that. There's a series of policies underneath that. The policies are important, but what's more important is the framework that it approaches. It engenders, saying that an incoming Labor government would prioritise deeper engagement with Asia, economically, culturally, geopolitically. We've got a series of policies that we've announced underneath that. They go to board literacy, mentoring program to encourage people with Asian business experience and language literacy onto Australian boards, similar and based on the relatively successful program that we already have, mentoring females onto boards to try and lift female representation on Australia's boards. They go to the diasporas in engagement. We have growing and vibrant diasporas in Australia, the Chinese community, subcontinental community in particular, but they're not coordinated in any meaningful fashion across the country to try and engender their skills, their enthusiasm to improve bilateral relations and people-to-people links. A whole range of policies under that framework. And we've got more to announce that we're working on. But what's more important than that is the prioritisation of that framework in our policy development, and also the rigour that we've put around it. I've said that as Treasurer I would report annually to Parliament on progress or lack of progress on achieving the aims within the Future Asia framework in a ministerial statement to the Parliament, which often seems like a good idea at the time, but can become more problematic if you're not achieving what you set out to do. But that's not a bad thing, because it provides a discipline and rigour for the entire government. For me to be able to say as Treasurer to the Cabinet, I've got to report on this in 6 months to Parliament. If we're not up to scratch with literacy, with board engagement, whatever the policy that we've announced is, then I'm going to be accountable to the Parliament, so we've got to lift our game, lift our performance. That's the rationale behind the annual reporting to Parliament. And the reasons, as I said, for doing this are just as important as they were when I talked in broad terms 12 months ago about our lack of engagement with Asia. And I find often that talking about literacy is the most effective way of underlining our lack of engagement with Asia. Literacy is important, of course, for reasons we all understand. If we're a more Asian language literate nation, our level of engagement and interest across the board will improve. Our level of respect within the region will improve. When I walk into meetings in Jakarta and can start a meeting with the Indonesian Finance Minister in Bahasa, it changes the whole tone of the meeting. It changes the entire level of warmth and engagement in the meeting. We don't finish the meeting necessarily in Bahasa. We drift in and out as we try and understand each other, and I make sure I'm not agreeing to anything I haven't completely understood. But it changes the entire level of engagement. And the literacy piece is one which I think underlines the degree of the challenge, the opportunity, or the scale of the task that we have in front of us. In this room, if I were to do an opinion poll and to say to you, how many Australians who are not of Chinese heritage can speak Mandarin to a level regarded as competent in business out of 24 million Australians? How many Australians who are not of Chinese heritage could speak Mandarin at a business level? Do I have any bids? Do I have any guesses? In numbers, not percentages, in numbers, in absolute numbers. John, do you hazard a guess?
No, but there's a few in this room.
Okay, good. Good. Nobody wants to guess. I'll tell you.
10,000.
Alas not. 300. 300 Australians can speak Mandarin to a level of business regarded as business competent who are not of Chinese heritage. And I think Jason may have shared with you a figure about how many young Australians are undertaking Mandarin at HSC level. The vast majority of them are Chinese heritage. And there are any number of likewise scary figures that I could share with you. In the case of Indonesian, more Australian students studying Indonesian in schools in Australia in 1972 than in 2018, at a time when Indonesian is more important, when Indonesia is going to be the fourth largest economy in the world, when decentralisation in the Indonesian political system has meant less power in Jakarta and more power in the regions, where the governors and mayors are less likely to speak English than cabinet ministers, but indeed more and more cabinet ministers in the current administration, not only not having been educated in Australia, but having less English than might have been the case in previous administrations. India, the fastest growing major economy in the world, on track to become clearly to rival, frankly, China and the United States over coming decades. In 1997, 6 Australian universities taught Hindi. In 2018, 2 Australian universities teach Hindi. Again, at a time when the importance of Hindi is increasing, Prime Minister Modi conducts all his meetings in Hindi. I know, I've been in one of them. He speaks very good English, but he insists on conducting his meetings in Hindi. And more and more, again, cabinet ministers and senior government officials are conducting their business in Hindi, as is their right, and our level of literacy has fallen, despite the fact that India is now our second largest source of permanent migrants to Australia. Our level of, again, non-migration driven language literacy in the country is falling. And this sends all the wrong signals, provides all the wrong indicators of our level of success. And again, we've got some detailed policies. We said we'd prioritise it through COAG. We don't pretend that it would be easy to all of a sudden turn this battleship around and start having every Australian school teaching Asian languages, or convincing every young Australian who's trying to maximise their university entrance scores that studying an Asian language is the smart thing to do. But unless we're trying, we're not going to make any progress at all. And frankly, as a nation at the moment, we are not trying. Frankly, as a government and as a nation, we are simply not prioritising this, which should be an urgent national task. So that's the main update since last time we met. The Future Asia Framework, as I said, detailed policies underneath and more to come, but more importantly, the prioritisation of this as the alternative government, with the reporting and rigour around it in government to attempt to get good and meaningful progress. Just in terms of the bilateral relationship itself, I know you've heard from Penny, but the main message I have to you is that in terms of the alternative government, we see our difference of approach as one of form and style and nuance. When it comes to foreign policy, you'll frankly find little difference of approach between us and the government in the region. Similar positions on South China Sea, similar positions on key geopolitical matters. Both parties supported joining the Asian Infrastructure Investment Bank. We supported it earlier, but nevertheless both parties supported it. The policies in many senses right themselves and are sensible. The difference of approach, and it's a vital difference of approach, comes in terms of style and nuance. I think, and I would put to you, the big problem with the bilateral relationship at the moment is that it has been dragged into the domestic political debate for the purposes of one political party, trying to score political points over the bilateral relationship. That is fatal for good bilateral relations. When one party says it's in their interest to politicise a relationship, when a Deputy Prime Minister talks about China being a bigger threat than ISIS, of course this has a deleterious impact on a very important bilateral relation. And so while the policy substance might be very, very similar, if not the same, on 9 out of 10 of the big issues facing us, I think you'll find the statements made by all of us, from Bill, Penny, Jason and myself, to be more grounded in a sensible discussion of a bilateral relationship, which will have areas of disagreement, which will have different perspectives, but should be based on mutual respect and not using a bilateral relationship for a domestic political internal megaphone purpose. That is some of the problem that we've seen. We've seen the relationship politicised in an unfortunate way. We've seen almost a mindset that any links with China are to be questioned or regrettable, that links with mainland China are somehow suspect, that if you're a Chinese academic or an Australian academic of Chinese heritage or a student, then somehow your motives should be questioned. This is all appalling and all should be regretted. Australians who are of Chinese heritage have an important contribution to make in the academic world. Universities are all about fostering debate. If an Australian student, whether they're international, domestic, of Chinese heritage, chooses to question a lecturer about what they've argued, I think that's what universities are about. Debating topics, having different perspectives put. It is not necessarily sinister. It should not necessarily be seen through a conspiratorial lens. It should be seen through the lens of proper academic debate and growth. And so what you would see, I would argue to you, is a mature, sensible, clear-eyed, realistic national interest approach from an incoming Labor government, keen in a reset of relations, but a reset of relations based on mutual respect within the framework of clear policy based on our national interests and our values, which won't always see us agreeing with any other country, let alone China, but will always see us approach that debate in a mature fashion, through a sensible form, and recognising the benefits for both parties of a growing and mature relationship. So, John, I thought just to cover those two issues in broad sense would be a good introduction before we throw open the room for questions. I said suggestions and I mean it. Our Future Asia framework is a work in progress. As I say to everybody, if you've got good ideas, if you've got any idea, I don't regard any idea for better engagement as a bad one. Some are better than others and some can be prioritised, but all ideas are welcome and would receive serious consideration as we put together future tranches of our Future Asia framework policy, because we do have more to do, and indeed more than welcome rigorous questions on any of the things I've covered or things that I haven't covered in the opening remarks.
Thank you very much, Chris. So we'll open up to questions, and perhaps I can just start while we're waiting for questions. The annual report to Parliament, which I think is a fabulous idea. Just one of the things you might think about there is whether you report on ministerial visits to China. One of the things that concerns us at Australia-China Business Council is ministers, they'll often go to the US, to UK, to Rome, to France, but they don't often go to China. And we think this is an important cultural change that needs to occur. So maybe that's one thing you could just think about.
Certainly. Yeah. I think that would be included almost inevitably. You would see that as a focus. I think I'm right in saying that Wayne Swan, as Treasurer, visited China more times than all the treasurers from Federation to himself combined. In his 5 years or so as Treasurer, he visited China more than every other Treasurer prior to him, cumulatively. In terms of our priorities in opposition, you don't travel as much in opposition, but in our 5 years in opposition, all my official trips bar one have been to Asia. Indonesia a couple of times, China twice, Singapore, India twice, and the only non-Asian trip I've undertaken was last week in Baghdad.
Okay, thank you for that. We'll go to questions.
Thank you for that presentation.
We're just waiting for the mic. Thanks. Laurie.
I can hear you, but not everybody
Laurie.
else can. So.
Thank you, Chris, for that presentation. My name is Laurie Piercy and I'm from UNSW in Sydney. And I think that many of us in the room are delighted to hear your focus on Asian literacy and Asian languages. Indeed, it was, I think it was the Hawke and Keating governments back in the 1980s who recognised this as fundamental to Australia's national interests. The numbers went south throughout the 90s and in the earlier part of this century. The Rudd government, with the former Prime Minister, he was a particular champion of this, and it reappeared in the early days of the Rudd government. But then the numbers kind of went a bit backwards, and it seems as though that Australia's had a lot of false starts here. I just wonder what an incoming Labor government would do it might be premature, but how do you think that a government can actually get this right once and for all, so that the numbers, we move in positive directions, and what kind of incentives do you think that that government should put on the table to encourage more people to take the plunge and learn an Asian language?
Yeah, thanks, Laurie. It's an excellent question, and I think you've nailed the issues. And we have had a stop-start approach. And what we need is a general approach which recognises two things. One, that this is a long-term investment. You're not going to get a quick turnaround, with the best will in the world. It's not a resourcing issue. Right? You simply can't turn this battleship around on a dime. Right? So you've got to recognise that and be alive to that and manage those expectations. We could have and would have a very good policy from day one. You're not going to get every Australian student studying an Asian language in year one. We face a lack of teachers. So we've got to look at our immigration settings, our education settings, all in one. And as I said before, we face a lack of willingness to undertake an Asian language. It seems confronting, particularly as a young person, when you're trying to maximise your university entrance score. You think you're competing against native speakers. We've got to confront that. So it's recognising it's a long-term challenge. I think there are things we can do on all the above, but it takes a while. And secondly, recognising, and this is a challenge for all of us in politics, to say, well, because it's a long-term challenge, we shouldn't have this stop-start approach. And if there is a change of government, you shouldn't just throw out everything the previous government's done because they did it. And there's been too much of that. And we're doing that, for example, on the new Colombo scheme. We had a scheme, they changed it, fair enough. We recognise the benefits of the new Colombo scheme, we'll keep it. We might tweak it a bit, but we'll keep it. It's different to Asian language literacy, but it's related, and it's a sort of indication of our general approach that where something's working, we'll keep it and enhance it, not get rid of it. And I think there's been far, far too much of that recently. And again, I'm not trying to be overly political, but it requires a COAG approach, and I was concerned to see, John, the opposition in Victoria, so that they'd remove an Asian language focus from the curriculum, or reduce the emphasis in the curriculum. I mean, that's all that's got to stop. Making that a political football and changing it when governments change is highly lamentable.
Craig Emerson.
Craig Emerson.
Yeah, I know who you are, Emma.
We know each other. President of the Australia-China Business Council in New South Wales. When Penny appeared, she talked briefly about the white paper in Australia in the Asian century, and I was listening to you talking about the Future Asia exercise. That white paper, I was obviously heavily involved, but I'd give it about a credit, not a distinction or a high distinction. But the Chinese side said to me that the most important thing about it is that it existed.
Correct.
And they said, you're the first country that has written a white paper on, a first Western country to write such a white paper. So I'm wondering whether perhaps the tearing down of that, and including the website with the change of government, and the reliance, as they said at the time, we're going to do action, we're going to do the China-Australia Free Trade Agreement. Has that been enough, or would a future Labor government reconsider that original approach, whether formally or informally, but having this umbrella of a future Asia project? So again, it's the value not only of the content but of the existence of a strategy like that.
Yeah, thanks, Mo. Again, we would treat the white paper as an important resource going forward. And it's unfortunate it was just scrapped. Was it perfect? No. But it was a very, very good start, and I agree with your characterisation of it. Of course, it needs to be refreshed now. It's now, what was it, 2012? Yeah, so that's at least 6 years old. Life's changed a bit, so it needs to be refreshed and renewed. But I've got a copy of it on my bookshelf, both in my office here and at home. Which I pull down every so often and check what I'm thinking about, what we're doing, reflects with what was in that paper, and points that they made, which we might want to consider and dust off and renew. So it's not the Bible, it's not the be-all and end-all, but it should be an important resource for any government dealing with this space, in my view.
Thank you. Further questions? There's one, in the middle there. Thank you.
Hello, my name is Rhys Roberts, Roberts Gray Lawyers, based in Melbourne. Rhys Roberts, Roberts Gray Lawyers, Melbourne.
Yep.
Thank you for your presentation and everything you've said today, particularly about language and nuance and the importance of dialogue in the language of the other person you're talking to. Can you hear me?
Yeah, I can hear you fine.
Yeah, great. So I attended a kindergarten a couple of days ago, and I asked what languages, and it was brand new. It's got a bunny rabbit, guitars, and everyone was happy. And I thought, what languages are you teaching the children? And so I've got two options at this school. It's French and coding. We tried Chinese, one of the first schools in Victoria to do that, but by the time we got to year 12, only one student went all the way through with it. But that's a school that gets excellent academic records at year 12 and so on. What's your view on the best language for a young child to learn, and the age when they should start doing it? And is French the best choice?
Pardon?
Well, thanks. It's a very common story, isn't it? I mean, the story that you put, and most of us in this room are of a certain age where we were all taught. I mean, I was taught French and German at school. Asian language wasn't an option for me. I had to catch up later. My children at least have an option in primary school of Mandarin, together with Arabic and Spanish gets offered to them at their primary school, which is a good thing. It's a decent development. In terms of the two questions, what's the best language to teach or learn? I think that's a matter for individuals and individual schools. I don't think there's a bad Asian language to speak or learn. I talked about Hindi. Hindi often gets lost in the discussion. Hindi is a very important language, and I'm told, because of the structure of the alphabet, not the hardest language in the world to learn. Mandarin is obviously a very appropriate language and important priority language. It's harder. That doesn't make it less important. It's just harder and not for everyone. And I think it's important to teach Mandarin early where possible, because all the studies I've seen, because it is a harder language with all those characters, if you start it in kindergarten and do it to year 12, you'll be competent, but you still won't be necessarily entirely business level fluent. So it takes a long time, and obviously the earlier the better. And I think preschools is actually a serious question you raise. I actually think there is a question about teaching languages in preschools in Australia, when kids are just soaking up information and knowledge at that time in their life. That is one of the things I'm thinking about, and we're thinking about how we can better engender very early language learning. There's a little bit of work occurring, some apps and some programs, but it's pretty limited more broadly. But I don't think we should be too determinative about the model of language teaching or the style. So, for example, there was a school on the north coast of New South Wales who heard that I was learning Indonesian and wrote to me and said, if you're in our vicinity, would you come and see what we're doing? And so I did. Coffs Harbour Christian Community College, they're called. And their model is they decided 20 years ago to teach one language and to teach it very well. And so they chose Indonesian, and from kindergarten to year 9 it's compulsory. And they have daily hookups with their sister schools in Indonesia, interactions helping them with English, vice versa. They have a Membantu program, which is an exchange where the kids in various years go and work on aid projects in Indonesia, etc., and helps lift their language. And they got 2nd, 3rd and 4th in the HSC in Indonesian. They said even they struggle after year 9 to convince kids to keep going with it, but they're having a red hot go. But that's their model. Now, other schools might choose to specialise in Mandarin or might choose to give students a choice of languages. I think we shouldn't be too determinative about that. I chose Indonesian because I see it as completely underdone in terms of the bilateral relationship, and also because I didn't think I was smart enough to learn Mandarin at my time of life. But and it's a comparatively easier language, although no language is easy to learn. Anybody who tells you that a language is easy, I think, is having you on. Some languages are slightly easier than others. I just think more is better, and the more we're teaching and the more students are doing it, the better. I don't care, frankly, if it's Mandarin, Indonesian, Japanese, Thai, Hindi, it all counts.
A question, second row. Yes, the microphone is coming. Thank you.
Treasurer, I really enjoy your very lively coverage of all the different arrays of language and your support for Chinese language. I'd like to give one observation. When I see students going through high school HSC or doing their degree, maths, free maths and English and science combined with Chinese, the dropout rate of non-Chinese student is high. And therefore, my recommendation is for the government to look at a 1-year dedicated course after they finish the high school, so they are totally undistracted. It is my concern of, we put a lot of effort in, and we have wonderful teacher, but because they just couldn't compete with those Chinese-speaking family students, in the end, so it's just one suggestion. How do you...
Thank you. Well, I think that's a decent suggestion. I understand the principle which you're applying. I mean, it seems everybody has a gap year these days. It wasn't the done thing when I was at university, but these days everybody has a gap year, and there are all sorts of things that people do on their gap year, and maybe an Asian language component offering to a gap year is a good idea. I'd have to have a think about that, but I see where that's coming from. There are other things we need to do as well. Some states do better at trying to equalise the HSC marks between native and non-native speakers. I think that, and I understand, I understand students wanting to maximise their chances in the university, and of course I understand that. But the weighting and the measurement is a key issue as well. Other ideas have been put to me. So, for example, as a concept, one of the most popular subjects at school today, wasn't offered when I was at school, is business studies. It's insanely popular. Everybody wants to do business studies. Nobody wants to learn an Asian language. What if you had the option of doing business in Asia course at high school, which had a language component, but also had elements of the business environments in the Asia-Pacific region and how you do business and the challenges? Of course, it's going to be at a fairly rudimentary level at high school, but if it piques the interest and encourages them for further study at higher education institutions, that's very much worth considering as well.
Okay, we're just about out of time. One quick question and one quick answer.
Sorry, George from Global Media Solutions again. Sorry, this might be unpopular, but I really hope that you drive language, and it's frustrating that my kids are doing French and not Chinese. I tried to get them in there, they wouldn't do it. And to the lady's point that people are dropping out because they don't think they get the marks, but I'd hate to see my kids and investment going into teaching them Hindi when, by and large, all the Indian community in Australia, and most of them will speak English. Even the Indian media, virtually all the major media is in English. The biggest English newspaper in the world is Times of India. So across Hong Kong, Singapore, it's almost 100% saturation of English speaking. So yes, if I deal in, and I deal all around the world, Indonesia, China media here is all in Chinese. So it's not quite, I don't agree that it's a blanket Asian language. Let's do Hindi, let's do Cantonese. It's very much very specific languages that I'd like to see encouraged for my children and for others. China definitely, because most of the media in Australia is Chinese, so that's an indication that there's really strong take-up of the language.
Yeah, thanks. I understand where you're coming from, but I don't agree. I think just because English is more prominent in another country doesn't mean having an emphasis on that language is less important here. Actually, only 11% of Indians speak English. Actually, that's the fact. Yes, it's much more common in the Indian elites and Indian media. Of course it is. But if we actually are serious about the economic relationship, you want to do business with more than 11% of the people. And of course you can do business through translators, etc. But I would regard Hindi as a priority language. And I don't think it takes away from the opportunities by having it as an option for people to consider in terms of both teaching and learning. So I respectfully would disagree.
Okay, so we're going to have to leave it there. We've run our full half hour. We're a little bit late starting. Could you please thank Chris Bowen?
Thank you.
Okay, we're going to move straight on to the next panel now. So could I ask Carol Allen, John Paolacci, Dan Collins and Ian Wishart, please? Okay. Just on introduction to this, at the 19th National Party Congress, President Xi Jinping made health and wellbeing a national priority with that grand ambition, you heard the ambassador talking about this earlier, to raise China's living standards but also their average life expectancy. China's elderly population is forecast to double in the next 2 decades, and the affluent rising China middle class is looking for quality health products and lifestyle services. So if you think of Australia, we share that challenge as well of an ageing population, but we're seen too as a respected global leader in health systems, products and services. And we've seen recent investments in Australian companies, GenesisCare, Swiss Wellness. They confirm, I think, China's interests in learning from Australia's experience in these areas. So the panel that we've got today, Carol Allen. Carol is the CEO of Sapphire International Holdings. John Paolacci, the partner of ShineWing Australia. Dan Collins, the Managing Director of GenesisCare. And also this time, second from the end, Ian Wishart. So Ian is the CEO of the Fred Hollows Foundation. So this is the first time we've had an NGO, a not-for-profit organisation here. With another hat I wear, I happen to be the national chair of the Fred Hollows Foundation, but we do a lot of work in China, in the poorer parts of China, and in 24 other countries around the world. And so we thought it was a great idea to have the Fred Hollows Foundation represented today for this discussion. So I'm going to sit down here. I'm going to sit down in the middle. And Carol, perhaps if we could just go to you first, if that's all right. CEO of Sapphire International Holdings. Just an introduction before we go to questions. So thank you.
Sapphire International Holdings evolved out of a company that I'm a director of, which is Sapphire Holdings Group. We own 33 aged care centres in Melbourne, and I used to be the CEO of Blue Cross, which is part of the company. I retired and decided what was I going to do next, and one of the other directors said to me, why don't we look at aged care? The reason we looked at aged care in China was that over the last probably 5 years, we've had an awful lot of people coming from Asia and China wanting to look at our aged care centres, looking at it and saying, oh, wow, this is just what we want. Can we go back and build something like this? And we said yes, and we made the decision that we would actually do some research, go out there and have a look and see what the interest really was. We found that over the last 3 years, I've been travelling back and forwards to China. There was significant interest. China is changing significantly in the way that they care for their elderly. The one-child policy has had a significant effect on the ability of families to look after their policy. People are living longer, and also dementia is an increasing area that has increased significantly as people live longer. So with all of this, we decided we would look for a Chinese partner. We made the decision right at the beginning that we would not go into China on our own, that we needed to find some company that was interested in it and wanted to join us in the journey. We eventually, after probably 15, 20 meetings with different companies, settled on Fosun, which is a very large international company. They had a very strong desire to open and to build an aged care sector in China. So we did that. For the last 12 months since we signed our JV, we've been building an aged care centre in Haidian in Beijing, and we are hoping, touch wood, that it will open probably at the end of July. It's been an extremely interesting journey. It's in my notes here, it says, what are the challenges and the good things? I've written down a lot of challenges. I won't go through them all, but certainly building an aged care centre, designing and doing the interior design of it, building a model of care that is reflective on our Australian quality standards and making it adaptable to go into China has been a very interesting journey. We've worked with some fabulous people in China, and no, I don't speak Mandarin. I know a few words, but we have managed to communicate. We've had hundreds of teleconferences, and my Qantas frequent flyer points are going through the roof. So that's good. The training is a big issue. The whole industry in China, or sector, is really probably 20, 30 years behind where we are. And so we are really starting back from the beginning. We're moving or trying to move them from a medical model to a wellness model. Our focus is much more on how do you focus on what people can do rather than what they can't do. That when people come into China, they're coming into aged care. They're coming to continue to live. The reality is that every one of us sitting here will get old. Probably 5% of you will go into aged care, and that 5% won't want to. There's no difference really in Australia and China in people generally. Nobody wants to get old and nobody wants to go into aged care. So how do we make it a good place? And that's been our challenge. And we would be very happy to show anybody around in about 2 months' time and come and visit us in Haidian, which is a beautiful part of Beijing. And we can share some of the stories.
Excellent. All right, thank you. There's a couple of good questions I've got coming out of that, but we'll wait till we go through the other panel members. John, can I go to you, ShineWing? And, of course, one of our sponsors here today. But over to you, Sean.
Hello, and I'd like to just give you just a very brief background on ShineWing, because we've got a bit of a China story as well. The firm, about 3 years ago, which was an established Australian firm, about 30 partners, about 200 staff at the time, decided to look seriously at an Asia strategy. Part of that strategy obviously involved China. And with that, over a 2-year period, doing quite a bit of work in terms of our strategy, our market entry strategy as well, and also looking at what the benefits might be and whether it would suit a firm like ours, we decided to engage with ShineWing International, and part of that engagement was meeting partners of ShineWing in China. Over time, we developed a relationship, I suppose trust, mutual respect, all those things I think we've heard about today to date, which gave us the confidence after about 2 years for the 30 partners to actually vote to change networks and join the ShineWing International Network. So in terms of our journey, that I think helps in terms of understanding a journey for a company to make that change is significant. With that came, I suppose, a couple of ShineWing existing partners and their staff, and also came the influx of Mandarin-speaking staff. That also gave us an understanding of the language, the culture, and also gave us the ability to understand our partners in China so that we're able to engage and actually do business together. One thing, joining a network, two, actually getting something out of it. So we had the ability over that time to build a relationship, and with that, it's a two-way relationship, and the benefit is that there's been investment in China from ShineWing China's clients and investment by our clients into China, where we've got people on the ground in China, we have a presence, people we can trust with the ability to be able to advise on local laws, taxation and regulation. Now, having said that, in terms of health and aged care, I also head the health and aged care team at ShineWing Australia. In terms of the challenges in health and aged care, I think Carol's story is of great interest. A lot of Chinese aged care operators are looking at the opportunities in China. The main reason for that is that margins in aged care are very tight in Australia. In terms of the funding model, it's predominantly government funded, about 70%, and 30% residents. With that, with an ageing population that's got higher expectations of the standard and quality of care, the funding requirement is increasing. So the issues for Australian operators is how do you get a competitive advantage, how do you have a sustainable business model. So I think in terms of looking at overseas and looking at the opportunities, I think that's something that is of great interest. In terms of the difficulty involved, in terms of China, the aged care industry is not very developed. When I've been there, it's been mainly property developers who are looking at getting into aged care because the government, through its policies encouraging and making health and aged care a priority, is providing land, finance, tax incentives, etc. So because of that, there's a lot of operators in China wanting to get into aged care. The challenge for an Australian operator is to find the right partners. Very difficult to do it on your own. And like the Sapphire group, finding a partner over there who's well connected, can build a facility, that is very important. So in terms of Australian companies going over there, it provides an opportunity, but it's risky. And if you have a brand name and you partner with the wrong organisation, it can actually damage your brand. So in terms of that, I suppose the important thing is to actually do your research and homework. It's very hard to do it alone, but also need to do a lot of due diligence around your partners and who to have a long-term relationship with. In terms of Australia, I see Australia and China have a shared issues or interest in aged care and shared values. The interest is around an ageing population, diminishing workforce to support that ageing population. The move towards home care in the last budget, probably noticed there was a lot of funding for home care, not so much residential aged care. And with the home care funding, that's so that people can stay home longer, which is what they want to do. It's cheaper to provide care in the home rather than build aged care facilities. And so that, I suppose the Australian policy will go that way. In China, they have a very similar policy where, in terms of their 2020 strategy or 13 5-year plan, and also their 2030 Healthy China plan, which is a longer-term plan that they have, It sets out that in terms of the aged care, they're looking at 93% of people pretty much staying at home, 7% having some sort of community care, and 3% in residential aged care. That still presents a huge opportunity. In terms of aged care, I usually look at people over 80, and people over 80, we're looking at about 22 million today, about 41 million projected by 2030, and 122 million by 2050. So those over 80 are big users of healthcare and aged care services. In Australia, it's a similar pattern. Look, I've probably said enough. I'll pass it on to someone else.
Right.
Yeah.
I've got some good questions for you later too, John. So can we go next to Dan Collins? Dan is the Managing Director of GenesisCare, and I think pinched one of our staff recently.
Thanks, John. Natalie's going to be very successful, and grateful to have her, and wonderful to be here today. I'd like to share a bit about GenesisCare and how we're taking Australian technology, innovation, people, and culture, and combining that with expertise from around the world, but also deploying that in China. Very briefly, GenesisCare is Australia's largest provider of cancer treatment and also cardiac care, and we're Europe's largest private provider of cancer treatment as well. What a lot of people wouldn't know is that we're the largest educator of cancer professionals, and we have a significant investment around R&D and also research and clinical trials. We're currently leading or a part of more than 150 clinical trials, including 5 first-in-human trials. And an additional feature of what we do is today we'll be treating do 10,000 separate patient treatments in Europe and Australia and Asia. And what a lot of people wouldn't know is that we are an excellent partner alongside local government in terms of them achieving their public policy objectives around equity of access, raising the quality standards, and making better public care more affordable for the taxpayer, or if there's no taxpayer, the government. So we have a formula about being outstanding at delivering super high quality and efficient services where access is for everyone, independent of your ability to pay. And it's that combination of the egalitarian spirit of Australia with our innovation and our ability to, I guess, have a go, sort of set us up for an opportunity to be successful, we hope, in China. And also, for those who don't know, the Australian healthcare system is actually very good by world standards. We get very good access, equity of access, and the value for money is good. Interestingly, though, reimbursement is relatively low if you compare that to the G20 or developed nations. And in a good way, a quality, accreditation, safety standards are very high. And what that means is that we've had to develop, I guess, our services and model in a small and dark room, so that when we've come out into the light, it's been a lot easier when we've gone offshore. To give you a reference point, reimbursement for healthcare in Beijing is not dissimilar to what it is here in Australia. So we've partnered alongside China Resources Group and Macquarie Capital, who have invested alongside managers and doctors to build out our Australian platform, to continue expanding into Europe, and then obviously into Southeast Asia and China. And that consortium's just been wonderful for us as we've moved forward. Firstly, they've backed very strongly our investment in regional and rural Australia, where we have now rolled out some 20 clinics in areas of need that weren't being serviced by public providers. And they've also backed a fairly significant R&D program locally, including around AI, introducing 3 or 4 new treatment techniques for cancer globally, and we can now take that offshore to Europe and then obviously to China. Our China plans are significant, but we're taking it one giant project at a time. We'll be starting with 4 or 5 major cancer treatment centres, some in the major centres like Beijing, but we're also working in some of the regional, smaller regional villages of 5 million people or less. And one of the things that we're doing, though, is staying true to our DNA around research and development, clinical trials and education. So GenesisCare will soon announce we'll be directly funding 50 spaces for doctors and medical physicists in one of the premier institutions in Beijing, so that we can help develop local workforce. Those professionals will train in Australia and in our centres in Europe, and they'll also be part of our research and trials programs along the way, and they'll be learning English, just picking up the theme from before in language. So we're very excited to be learning our way through China. We have a fairly open stance. We create alignment through localised objectives around better quality care, providing better access, being a collaborative partner, and finding if we can bring the best of the world together in a single spot. I grew up in Brisbane, and it didn't take me long to work out that all technology and innovation originated in Brisbane. So I was fairly used to looking outside to see how else we could do it. Delighted to be here. Thanks, John.
That's great. Thank you, Dan. So we'll have some questions for you soon too. And just our last panel member today, Ian Wishart, CEO of the Fred Hollows Foundation. So Ian, welcome to your first ACBC networking day, and over to you.
Thanks very much, John. Healthcare and aged care in China, the topic of today. These are really two areas that intersect with the Fred Hollows Foundation work in China and around the world as we deal with blinding diseases. And you're all young, so you probably don't realise this yet, but many blinding diseases are the result of ageing, and particularly cataracts, glaucoma and macular degeneration. Also bring to you today a unique perspective because we're a not-for-profit. I was talking in the break with Genesis, and there's a lot of similarities about what we do, building up health systems. We come up from the not-for-profit point of view, I guess. We've been working in China for 20 years, so people who talk about a long-term, sticking at it in China, we know that, we've done that. Over 2 decades, we've worked in provinces like Anhui, Hebei, Yunnan, Inner Mongolia, Xizang and Xinjiang. And most of it's been pretty quiet work, restoring the site to people who are really at the edges, more marginalised people. But we've built very strong people-to-people links and good links with government. And to my knowledge, we're the only Australian-based NGO that's been doing this level of work. We now have permanent offices in Beijing, Kunming and Hong Kong. And we've had a partnership for 20 years with the government of China, and we really value that partnership. Together we've achieved amazing things. So last year we screened 884,000 people for eye conditions, delivered more than 310,000 eye operations and treatments, and we've trained more than 3,500 people in eye health, allied eye health workers, and 57 surgeons. So these figures add to our growing numbers over the last 20 years. We've performed more than 1 million eye operations and almost 100,000 cataract operations. Numbers are numbers, of course, but it's important to remember the human face of our work. We will be hosting a reception at the Australian Embassy in Beijing to mark our 20th anniversary later this year. You're all invited, if you can make it. Frequent flyer points, maybe get you there.
Yep. Probably be there anyway.
And we'll have one of our successful patients there. So Zheng Bao Li is 87 years old. He's a musician from an ethnic minority in the mountainous regions of Yunnan, and he likes playing a bamboo reed flute instrument called a lushong. It's culturally significant to him and his group, and as he says, I've spent almost half my life teaching young people to dance and play lushing. This instrument is a carrier of my culture, connecting my generation. In my family, there are 5 generations. We all live together. We're playing lusheng with my 21 grandchildren dancing around me. It was one of the best moments of my life, but it slowly disappeared from my sight. When we found Lee, he had been blind for 3 years already and had given up hope of playing again and teaching the young people how to dance and sing and play the instrument. With a 25-minute operation, we freed him from his blindness and gave him back the ability and power to play an active role in the community. And we've done that globally for more than 1 million people. So we'll be very happy to have him at the Australian Embassy, and hopefully you'll be there too. But it's stories like those that are really at the heart of our work, even while we remember that there's so much more to do. It may surprise you with China as, you know, a growing superpower, that it has the highest burden of avoidable blindness in the world. It actually accounts for 17% of global blindness. Maybe that's just a result of its population, but if you do the maths, I think you'll also realise it's disproportionate, slightly. And cataract is the leading cause. That's a clouding of the lens in your eye. And it's a 15-minute operation. It's very low cost, and you can have actually better sight back than you probably had before. So while more funding for health has improved eye health services in some regions in China, as we know, there are certainly challenges around access, as we heard already, and community education. 80% of the people who are blind in China don't live in probably Tier 1, Tier 2 or even Tier 3. They live in rural areas, far from the hospitals. But 3/4 of the doctors work in urban hospitals. So our job is focusing, how do we get eye services to these people? We are very encouraged by President Xi's Healthy China initiative. It's one of the biggest health initiatives in the world, a big reform program, and it is designed to extend health services beyond urban centres, which we're very pleased with. We want to deepen our collaboration with the government and also with the people of Australia to extend out, and by working in partnership with the government, the private sector, we believe we can deliver even greater achievements in China. So restoring sight to more people in China means healthier and more productive citizens. You may not know it, but every dollar you invest in eye health by restoring sight will give back $4 to the local economy. So even in one province alone, it would cost $1.5 billion to solve blindness in Yunnan, but it would generate $4.8 billion worth of productivity in the local economy. So we're very much focused on the economic benefit, and we will continue to work with China to release this productivity benefit, especially to the rural poor. You know, you might wonder why in a rich country we've got a not-for-profit like us working there, but the job of a not-for-profit is really to demonstrate models that reach the most inaccessible people and then let the government scale it up, and that's what we do. One other thing I'd like to say is that as you expand your businesses into China, it's very important to build your social licence to operate. And through effective corporate social responsibility with a respected charity partner like the Fred Hollows Foundation could be a critical piece in your investment strategy. We've been there a long time and we're very trusted, and we're at the forefront of improving China-Australian relations. So it's through strong partnerships between not-for-profits like the Fred Hollows Foundation, government and the private sector, we can help realise the ambition of ending avoidable blindness. I'd just like to close with a few comments about the Belt and Road Initiative, because this represents the largest investment in global infrastructure in more than 50 years. As I said in my question earlier, it shows real vision about how we can bring prosperity to the world, and it's also a rampway to allow business to expand. And I would like our Australian government to have a similar kind of vision for how it can use soft power to help business and help people with health. Now, Belt and Road's really important for Fred Hollows Foundation because we would like to work with the Chinese government because it's not just roads and infrastructure, it's also health services. And we would like to bring the benefit of sight to people all along the Silk Road, if you like. We already work in many of the countries that are in this region of influence, and we have the expertise that we could apply. I'd also like to say that although we're not-for-profit, we're actually agnostic about how eyes get fixed. It could be a not-for-profit, it could be the government, it could be the private sector. We even Fred Hollows has its own private sector initiatives to bring eye health. So we're really very positive about the Belt and Road Initiative, and we believe that there's real opportunities there in the health sector. So in conclusion, let me say that after 20 years working with some of the poorest people in China, we know the value of extensive relationships and trust in working in China, and we're happy to share those experiences with you. And anyone working in the health sector, we're always interested in partnership discussions. So thank you very much.
Good. That's great. Thanks, Ian. And interesting story. You know, we, as I said, Australia-China Business Council, we're about businesses, but if you think of Fred Hollows Foundation, 20 years ago was a little show that turned over $2 million a year, and we're close to $100 million a year now in 24 countries around the world. And the work that we do in those poor areas, many of those poverty alleviation zones in China, just makes a profound difference to people's lives. So great partnering opportunities too for any businesses running forward. So thanks, Ian. We'll go to questions from the floor in a moment. Just a couple from me first, if I could. Carol, just one to you to start, if I could. You said on the sort of training and infrastructure and service provision side that China is probably 20 or 30 years behind where we are. So one of the things I've learned about China is if they're 20 or 30 years behind, that's sort of in Western time. And so how many years do you think it'll be before they catch up? Will it be 20 or 30 years, or will it be 3 or 4?
No, it'll probably be around 5 years, I would think. There's a lot to learn, particularly in changing the way they think about ageing, and they think about death and dying, and they think about the fact that aged care is more an illness than a part of life. And the training has to start from what people believe and what they think and how they view living. So I think that kind of training will take longer. We can teach somebody to make a bed and to lift somebody in to administer medications. You know, that'll take us 4 weeks, 5 weeks, and the more people we train, the more people will learn. We're running an exchange program with our centres in Melbourne, where we're having some of our workers come over and work in them, and we've got a couple of Chinese Australians coming over and working in the Fragrant Hill Mansion, it's called, and we think that kind of learning will be much quicker than the actual changes to the culture and the way people think about ageing.
Thank you. And John, to you, you mentioned the industry not being very well developed. I think, and you mentioned those figures. You know, they're more than 80 years, but 3% being in residential aged care. What does 3% translate to today in China?
Look, I haven't got my calculator with me, John, but it's a large number. But currently there isn't anywhere near 3% in residential aged care facilities. There just aren't enough residential aged care facilities. Currently, the model that I've seen has been institutional care for those that don't have any social or family support, so it's sort of a last resort. And a lot of the interest is around developing more of a retirement living model, where they talk about resorts, retirement living resorts, where they're high end, and I suppose for the wealthier middle class. So in terms of a strict aged care facility as we understand it, and I think as the Sapphire Group has built in Beijing, which is going to cater for people who have care needs, medical care needs, they're not looking at that in terms of the private sector. But the government has encouraged the private sector to get into aged care and build facilities and hospitals as part of its 2020 plan, 2030 plan. So it will happen, and it'll be an imperative. The ageing population, with that, there's frailty, there's dementia, there's all the other things. So I think the future will be that it will develop, and I agree that it will probably happen very quickly, as it does in China. Things happen very quickly. The government has reinforced this policy strategy of hospitals in building 1 or 2 hospitals in every county in China over the next to 2030, increasing the number of doctors, increasing care workers, etc., looking at e-health, telehealth, digital health in terms of being able to roll that out. So technology around that's really important. I think if Australia has the ability to participate, I think it's around that. We have a large country where we have the same issues in terms of providing remote health. So we've developed some good technologies around that. So I think there's opportunity there. But China's not just looking at Australia. Japan is setting up aged care facilities in China. They look at North America models, France, Singapore, Germany. So we need to, I suppose, be visible and be active. And I know with hospitals, there hasn't been a lot of success with Australian hospitals going to China, but a lot of North American ones have. And I understand that's from many years of delegations from North America going to China. And that's despite the healthcare rankings. Australia ranks, or in a recent survey by US researchers, Australia was ranked 2nd in the world for its healthcare system, and in developed countries, that is, 2nd in the world. The US in the same survey was ranked last. Yet we don't have that presence in China that I think we could have.
All right, thank you. Dan, can I just ask you, what do you think are the major public health issues which China and Australia are going to face over the next decade or so?
Thanks, John. Well, they're substantially the same. So 1 in 3 Australians will get cancer, and 1 in 2 over 40 will get heart disease, and you extrapolate that to China, it's basically the same, albeit a slightly different mix. And the Australia-China problem is actually a global one, which is how do we give better quality care to more and more people, which becomes more and more expensive, and either governments want to pay less for more, but just like consumers want to do that themselves. So that's a shared problem. It's a really good... Australia's got fantastic pedigree in developing world-class healthcare technology and services, and I'm thinking about Cochlear, ResMed, CSL, and hopefully GenesisCare one day be considered in that category. So how do we then take that innovative spirit around a shared purpose and fix a problem? So I think that's really the issue. There are 5 million Chinese that will get diagnosed with cancer this year, and unsurprisingly, many of those will miss out on the care that they need, or they'll miss out on the care at all. Not dissimilar to the anecdote in respect of the Fred Hollows Foundation. So, shared policy squeeze. We've got some capability, and but one of the interesting things about we see in China is that where a lot of things in healthcare have developed out of Western markets, and in particular the US market in healthcare, I think it's great that the Chinese are sidestepping that. They're not going to repeat all of the problems of the US healthcare system. and they're going to bypass all of that waste, litigation, inefficiency, bureaucracy. So I think there'll be some completely different models of public health policy delivery as a result.
And do you see the rollout of a primary healthcare system in China as a high probability? I mean, a lot of people would say they don't really have a primary healthcare system, and if they do companies like GenesisCare have a role in that?
A version of it will occur for sure. In terms of there isn't a primary a GP network like you'd be familiar with, and you'll go to an outpatient waiting room in a hospital like this, times maybe 5 times bigger actually, and it'll be very busy. And we're not just trying to be excellent at cancer care and cardiac care or training and teaching and research around that. If we see an upstream blockage, say around breast cancer screening or prostate cancer screening, we'll be we'll be there in the diagnosis as well. But we're also developing a lot of scalable models, remote monitoring, community monitoring, to actually just change a different model again. So rather than have people come to GP networks, there's things you can do and distribute self-assessment and diagnosis first.
Thank you. We'll go to questions from the floor. If there are questions there's a few questions of 1, 2, 3, 4. So Phil Honeywood. So we've got about 10 minutes for questions, and then we've got to have a quick break for afternoon tea. But yeah,
thanks, John. Look, I'm just back from Saudi Arabia, where 35% of the population are guest workers, primarily Pakistani, Filipinos, on 2-year contracts. And of course, we know in the aged care industry in Australia, it's recently arrived migrants who do the lion's share of the hard work in aged care facilities. I was recently asked at an ACBC Victorian education panel meeting, wouldn't that be the next frontier for our universities, providing aged care and our TAFEs aged care training for Chinese citizens? But my hunch would be that, just like Saudi Arabia, sooner or later China's going to rely on guest workers to do a lot of that heavy lifting work, given that the one-child policy is often aspirational in terms of wanting the child to do professions, etc. In that context, would Australian education providers be perhaps better off doing some training of aged care workers in a third country to accommodate the labour costs and the perhaps lack of aspirational interest in issues around aged care training, other than perhaps aged care management at a more senior level?
So you might be talking about Philippines or Vietnam, for example. It's a good question. Who wants to have a go on that?
Look, very interesting idea, actually. In terms of, I think it's a good idea. The issue: how would that be funded? Who would fund that? So that would be the difficulty in terms of getting that program up. But I'd expect that ultimately it would provide skilled workers who would be prepared to do that work. And I agree in China that probably the aged care worker it's not something that's held to be an actual profession or so that is a difficulty, and I think they have people coming in from Korea and other places that help in terms of fill some of that space. I think the immediate issue though is that I think there's a huge opportunity for TAFEs, etc., to provide health and aged care training, and the training's around care workers, nursing, but the delivery of that training I think is the key. I think there's the need, and in China when I'm there they ask about training and training opportunities in terms of organisations that want to be involved. So I think that's a huge opportunity, and not only in aged care, I think also with the hospitals. One of the big issues with the hospitals being full, people going to hospital, generally if they go from an aged care facility, they go there and they'll stay there, because if they leave it, they won't get any care, any therapy or or treatment after they leave the hospital. There's no rehabilitation type workers or services. So for that reason, I think there's a big opportunity also for hospital in terms of rehabilitation training, but something that may not be to the rigour of an Australian qualification, but something that provides enough skill and ability to be able to undertake the work to relieve the system, because the Healthy China policy is really ambitious in terms of what it wants to achieve. Chinese government generally looks at achieving its policy objectives, has very clear targets. So if you look at the policy in terms of where is China going, it takes away a lot of the uncertainty if you read the policy. So I think embarking on that sort of strategy where you can deliver the training, whether it be digitally or face-to-face, or getting that right, I think is a huge opportunity for our education institutions.
Okay, very quickly on this.
Yes, well, China's got a project at the moment where they're wanting to send 20,000 of their registered nurses to Australia and the UK to get them trained up for another 2 years so they can come back to China. So they're looking for partners. They're also looking for people who will make that financial commitment. They'll provide the visas, but that's all they'll provide. Just interesting.
Will they pay for it?
No, they won't pay for it. The people must pay for it themselves.
Yes.
So, so there's no funding. But there's still a lot of Chinese who would happily, if they can afford it or their parents can afford it, will send their children over here, and to the UK. In our aged care centres, we've got 64 different nationalities working for us.
Very quick, just follow up on that. So 20,000. So who are the typical providers, Phil Honeywood, of the training?
You have Box Hill TAFE in Victoria, an example.
Swinburne, RMIT.
And presumably some in other states as well. Further comments on this one? No, thank you. There was a question, I think the second question was here. Yep.
So, I'm from Panellists. We do a lot of aged care projects in Australia and also I'm Nick. I'm from Partners International. So we do a lot of aged care senior living projects across Australia and London and in the United States. And thank you all for sharing the experience and your point of view. Particularly, I have a question for John. You mentioned about home care. I just want to know a bit about home care in your opinion, because home care is actually not so successful in London because of the limit in time of the carer to taking care of the elders. There is actually an incident that an elder was found drowned because the carer has only 30 minutes to take care of the elder. So what's your strategy, opinion to how to make this safer in China or in Australia?
Yep. Thank you for that question. Look, I don't actually provide any home care directly, never have, so I'm probably not the best to answer that. Maybe Carol would be better. But in terms of home care, in terms of residential aged care, I act for some aged care providers, and one of the big issues that they have is that usually the resident goes in once they've had a fall or an accident and they become quite frail. So the home isn't always the best place for an elderly person to remain indefinitely. So I agree with that. I think the home, especially a home that's not fully equipped for an elderly person. So obviously putting enough funding into the system so that the home can be equipped to cater for an elderly person, number one, that it's appropriate for the person, and that this adequate supervision is really important. And I think you'll always have incidences where people stay at home and will have accidents. Okay. And I think that's sometimes a choice, that people want to stay home longer, but I think it comes a time where, for certain reasons, it's actually safer to move into residential aged care. So I think you need a mix of both.
Okay. Okay, thank you. Quickly on this, Dan or Carol?
What the Chinese government is looking at is more daycare. So around 7% of their aged care population, they want to get into daycare, which is providing 5 days or 7 days a week of care for them and then sending them home at night. That's significantly cheaper than putting them into residential care. And I think that is where you're going to see the growth in China, much more than in the daycare. Operating daycare is extremely difficult. It's unsupervised. It's prone to all sorts of difficulties, and you have untrained people and unsupervised people. And the risk to operators operating home care, both here in Australia and because we've done it, and in China, is a great risk.
Dan?
John, thank you. The opportunity for Australia is to introduce the disruptive models around remote monitoring and prospective care management and outcomes-based management. One of the trials that we've had is we remotely monitor those with a pacemaker or a defibrillator, remote monitoring of wireless pacemakers, and that prospectively we track their performance. We can actually see if something's going wrong in the home. And there are a whole lot of preventative algorithms that go with that. So I think the answer is, for China, new models, remote monitoring, empower the consumer in their home, outcomes-based care, keep them out of hospitals.
So I had a question on that. So a mix of online and bricks and mortar?
Absolutely. But to crack the code for a big problem in China, you'll need a lot of bricks. So I think using the local community and their families, remote monitoring, and empowering the patient with education and models of care around nurse facilitation are just as powerful.
Okay. We're going to have one more final question. Yes? And yep, Mike.
Excellent.
Yep.
Congratulate the speaker. They're excellent. In particular, I actually, apart from the Australia-China Council, I work for a Swiss human resource company called Deco. It's the biggest in the world. We built in the last 6 years from 40,000 to now 1.3 million staff. So what we're talking about today is the 4-2-1 phenomenon. One child supporting 2 parents, and then 4 grandparents. In my office, with my staff, where they have elderly people, already they have mobile app, which have video camera right through the home to make sure they monitor the carer. That, of course, not everybody could afford it, but it is the way to go. It's a brick and mortar and the disruptive technology. I particularly congratulate Dan and Carol. When you joint venture with China, you need to have affiliation, like your oncology school, because they supply your doctor and the nurses, and there will be a regular supply stream. Very difficult to recruit them in the public market, and I think what Carol has done is outstanding, and I hope you can extend it. What we did, how we grew, was called TTT, Training the Trainer, and I'm sure you could apply that model.
We are.
Yeah, indeed.
So quick comments on that, particularly on the 4-2-1 ratio?
Yeah.
And we are going to finish up in 2 minutes.
That is the ratio. I'd struggle to handle it myself. But basically, you have to use a combination of remote monitoring, new business models, empowering other types of skilled workforce beyond doctors, and that's how it's got to happen.
Ian?
Yeah, just I can comment on workforce, because Fred Hollows started that 25 years ago, training a Nepalese surgeon and a few Vietnamese ophthalmologists, and now that's turned into tens of thousands of ophthalmologists around the world. But it's not just the ophthalmologists, you've got to get the allied health. If you don't get the mid and lower level staff in place, you can't expand your business and you can't reach the scale that you need, and I think all the businesses here will face that. And you've got to have a connection, particularly in a country like China, you've got to have a connection with state-based centres of excellence. Otherwise you're sort of operating right outside the system, and that's just not possible.
That's right.
Thank you. Very quickly, John.
Yeah, I think that training is the key. But on the 421, I think the impact of that, the one-child policy came in 1979, 37 years ago. Or when I say 37 years ago, it became a two-child policy from 2016, so 37 years of one-child policy. In terms of aged care, I don't think we've actually seen the real effects of that, because a lot of the ones that are over 60 probably have more than one child. They were before that policy. So I think the future will actually, there'll be a compounding effect of that. With the two-child policy, I don't think there's been a huge uptake of it, which is interesting. So probably won't change too much.
That's a very interesting point. Carol, your final say?
The final say is that I was listening to one of James's podcasts, and there was a woman who's talking about China, and she was saying at the moment there's 5 workers for every one person over 65. By 2050, there's going to be 1.5 workers for every person over 65. So we're going to have in China a massive problem in relation to staffing and how they're going to staff and grow the company. And she was saying China's going to grow old before it grows wealthy.
Well, that's an interesting issue. If you look at other countries around the world, if you look at Japan and Korea, probably moving into that, and will China and Australia go the same way? But history will decide that for us. Can I say that was a great panel? Thank you. Ian Wishart, when you've got a date for the Beijing launch, for the Beijing 20th anniversary, we'll probably circulate that through China Business Council, so that if anyone's there in Beijing, I know the ambassador would love to have people there as well for that. Can I thank you all on the panel? We've got now because I've run over time, poor moderator, we've got just a 10-minute afternoon tea, and then we're going to come back and we've got an hour for the session that Helen is moderating, and then the PM's going to come in at 3:45, and we'll go straight into the PM for just 15 minutes. So the afternoon will get pretty tight. Okay, so we'll have a quick 10-minute break. Thank you very much.
Thank you very much, gentlemen.
Well done.
Thanks very much.
Thanks, Sharon.